Hey everyone, this is Dr. Dustan Mattingly, and this is Kamryn.
Hello.
So Kamryn is going to allow me to do pressure points on her neck and her down her arm. And this is a demonstration on how to do pressure point therapy for carpal tunnel syndrome. So I'm sure that many of you have heard of that condition. It's a condition of which the nerve gets pinched in the neck, and it causes pain down the arm and into the wrist and hand. And one of the classic symptoms of that is, of course, waking up at night with numbness and tingling. Other things that happen with patients is that they can't hold on to things. They drop their coffee cup. Important, you have to hold on to your coffee cup. Can't drop and lose your coffee. So here's what we do with the pressure points for carpal tunnel syndrome, okay? So we're going to start with the neck, and we've got of course, the back here, the back side of the spine. You can feel those bones, and we're going to take your thumb and you're going to move off the spine about an inch, and then start doing the pressure points. And you can support the head just a little bit so that so that the patient doesn't have to push their head back at you. Okay, is that pretty comfortable?
Yeah.
Okay, and I'm just using pressure with my left thumb. Okay, and then supporting your head with my right hand, and then we just get to about 6 or 7 pressure points in the neck. Well, it depends on the length of the patient's neck, but 5 to 7 pressure points. You have 7 cervical vertebrae or neck vertebrae, so with Kamryn we'll treat about 5 of them. Hold them for about 10 or 15 seconds. And some of them can be pretty sore, especially the ones as you get down into the mid to lower neck. The mid to lower neck is the nerve supply down the down to the shoulder, arm, forearm, wrist, and hand. Okay, so that mid neck and lower neck is important for the function of the wrist and hand. Okay, so here we go. I'm kind of doing this a little bit fast, but 10 to 15 seconds. Hopefully you won't mess up the patient's, your person's hair very much, but all right, how's that? You doing okay?
Yeah, I'm very
good. Okay, we're here in the Cardinal room too. You can see some pictures of some of the Cardinal players there, so we do have different rooms. We have a blues room too. So here we go. Now I'm going to do the upper trap, and these can be sore.
Oh, yes,
so you can see my hand. Okay, yeah. Okay, and here we go. There's another one, upper trap, really sore. And another one. Now, as I'm doing these, sometimes the patient will experience some tenderness and tingling into the wrist and hand. That would be an active pressure point if you experience the kind of a referred type of a pain sensation. Now, you can also get some pressure points in the back of the shoulder, along the shoulder blade. Sometimes these can be very, very tender. This does not take a whole lot of pressure to get a result with these, by the way. Of course, my thumbs are pretty strong. I've been doing it for 26 years, or been doing pressure points for about 16 years, 15, 16. And being a chiropractor for 26 years, your hands get pretty strong. You okay?
Yeah, I get that tingling sensation.
Okay. Yeah, that's just from doing this pressure point back here on the shoulder blade. That's a lower rotator cuff muscle. Yeah. So, okay, then you can come down into the deltoid muscle. And that can be pretty sore. Yeah, well, I guess I'm pushing on a pretty tender one. All right, now, okay, so I'm going to switch around here. Now, these points here, you can do pressure points in the bicep. These are weird. These can feel weird. You okay?
Yeah.
Yeah.
I feel.
They're different. They're different pressure points. But you do it right in the middle of the bicep. I do 2 of them. Real easy pressure points. Yeah. All right. You can get the Dr. Michael Pincus is the developer of pressure point therapy, and you can get his training booklet. You just Google it on Dr. Michael Pincus, and he's a chiropractor based out of Minneapolis, St. Paul area. And so he has these home kits that you can get. Okay, and then the tricep, back of the tricep. This one's a little bit more difficult, but I'm just going to use my hand. I'm using my middle finger on this one, just kind of pushing in there. These are not even the tender ones. Just wait till I get to the tender ones. But I tell you, these can yield spectacular results by doing just the pressure point treatment. Okay, now these are the ones that usually cause the most pain, and I'm going to work on these points that are right in this area, right on the forearm. Okay, so here we go, and these can be very, very tender.
A little bit.
A little bit. She's struggling a little bit with it. All right, and then you can kind of move your contact point around a little bit and find the bad ones, the bad pressure points. Now I'm just kind of in the middle of the forearm, like right in this area right there. Those usually don't result in too much pain from the patient, but work those areas over there. Now, of course, the best handling for a patient that has carpal tunnel syndrome is to not only get the pressure points worked, but to also get chiropractic adjustments to realign the spine. Many times you have to deal with some shoulder issues, and then many times this elbow needs to be worked on, actually doing chiropractic adjustments on the elbow, and then really working on the pressure points in this area. Then of course, there's chiropractic adjustments that you can do of the wrist and hand, very, very beneficial for patients with carpal tunnel syndrome. So again, most of the problems that patients get with carpal tunnel syndrome start in this area and go down and into the wrist and hand. And I know that the medical profession, their handling is to cut this ligament right here. It's a ligament right here that makes the tunnel, the carpal tunnel, and that can alleviate the symptoms, but it really doesn't solve the problem. So here at Mattingly Chiropractic, we deal with handling the problem to get rid of it, get rid of that pinched nerve. So anyhow, if you have any questions, give my office a call at 314-635-1008, or you can email us at info@drdusty.com. And so if your spine is all rusty, call Dr. Dusty.